Oh, not so good. Hello. Let me turn off the lights.
Yes, so we're waiting on a few of the other GPSC members to join.
Hello?
Yeah, so we're currently waiting on a few of the other GPSC members to join. So like
Sure.
around in 10 minutes.
Let me see if I can sit somewhere else. Let me see if I can go the other way. I'll be back. Okay.
Yeah, that's fine. Okay, no worries. Thank you. All right, I'm going to allow people from the waiting room in, okay?
Okay. Okay, good evening, dear graduate students. My name is Shahnaz Rafi. I am the current chair of Graduate and Professional Student Committee at Florida International University. So I welcome you to this virtual Gradskellar for the first time, and we're also launching a new series called Alumni Series Panel. We have invited 3 of our distinguished alumni who are very successful in their particular career and also in their life. So today we will be talking about a lot of issues: how they manage their stress, how did they graduate, how did they find the jobs, and most importantly, what was the key to their success in their life. So now, before I introduce the panelists, I would like to invite the current GPSC at FIU, the team, to introduce themselves. I invite my Vice Chair, Christian Perez. Christian, could you please introduce yourself to the people?
Hello, everybody. Thank you for joining us in our Gradskellar for fall 2020. My name is Christian Perez. I'm a current PhD candidate in the Department of Environmental Health Sciences and the College of Robert Stemple Public Health. So today you're going to be listening from a few panelists regarding their experiences as FIU graduate alumni. And I'm glad to see all of you here. And please come back for GSOL next semester, as this is one of our first events that we will be holding. Thank you.
Yeah. I'd like to invite Nitya Ramalingam. Thank you.
Good evening, everyone. Like Rafi said, my name is Nitya Ramalingam. I'm a second-year medical student here at the Herbert Wertheim College of Medicine. And thank you all for coming. That's all I have to say right now.
Thank you, Nitya. I'm going to invite Sandra Alvarez, please.
Hi, everyone. Thank you so much for joining in. So my name is Sandro Alvarez. I am currently a master's degree student. I'm doing my master's in public administration with a certification in human resources from the Department of Public Policy and Administration. And I currently serve as the finance committee liaison for the GPSC. Thank you.
Thank you, Sandra. I'm going to invite DeMarcus Snipes, please.
Greetings, everybody. I am DeMarcus Snipes. I am a Global Strategic Communication Master student at Florida International University. And I also serve as the GSOC chair for our graduate senator committee. And I look forward, and I really appreciate you guys coming out to listen to our panelists. And I look forward to the conversation we have today.
Thank you, Marcus. We have another committee member. Her name is Camila Fernandez. She is the event coordinator, but she is unfortunately missing this event today due to some inconsequential event. So now I'm also a PhD candidate at economics, and also this is my last year as a PhD candidate. So now I would like to invite our panelists. First, I'd like to ask Mr. Dr. Alleman to introduce himself to the audience, please.
Yes, good evening, everybody. My name is Eugenio Aleman. I graduated from the FIU Economics Department with a PhD back in the days, prehistoric, in 1995, actually, late 1995. I also have kind of a bachelor's in political science. I have an MBA in marketing, and an MA and a PhD in economics from FIU. I have worked mostly in the private sector. I have worked in Shell Petroleum for several years. I managed a restaurant for many years. This was a family business. It was blown out by Maria in Puerto Rico. So it's no longer in existence, but it lasted for 41 years. I've worked for a consultancy. Now it's called IHS Markit for 7 years. I have been working for Wells Fargo Bank for 16 years, 16 years. And that's it for now.
Thank you, Dr. Alleman, for your nice words. So now I'm going to invite Dr. Sahar Ajabashir to introduce herself. Thank you.
Good evening, everyone. My name is Sahara Jabshir. I'm an assistant professor in the College of Medicine at FIU. I'm a proud double alumni of FIU. I got my master's and PhD in dietetics and nutrition from the Temple College. And all my family, my other family members also got some degrees at FIU. My brother got his bachelor's there, and now he's becoming a dentist in Europe. My cousin got his MD degree, and now he's becoming a cardiac surgery fellow. And my sister is also coming to FIU to get her PhD in engineering.
Thank you, Dr. Bashir. It was really quite an accomplishment for you and your family. Thank you. I'm going to invite Mr. Andrew Clevos to introduce himself. Thank you.
Hey, good evening, everyone. It's such a pleasure to be here, and thanks to the host for getting this together. I think it's a wonderful opportunity to always connect alums, current students, and people in the industry with one another, because networking makes it happen. So really happy to be here. But I'm Andrew Clevis. I am a FIU alum from the MBA program. That was in 2013 that I graduated. And I'm also a current PhD candidate within the School of Public Health. I am within the health policy and management with a health systems research focus. So I just matriculated into candidacy at the end of last year after I successfully defended my proposal defense, and now I'm slogging my way through the administrative requirements to slowly get to done with my research. So before I came to Miami, I'm actually a Minnesota native. I made my way down to Florida by way of a few places. I originally went to my undergrad at the University of Minnesota for physiology. After some time there, I had actually worked quite a bit in healthcare ever since I was a teenager. I grew up in a very small town, actually in a farm outside a very small town. And I got plugged into healthcare through my brother, who was a nursing assistant at a nursing home while he was going to high school. And this is a great paying job, considering the amount of work, but you earn $7 an hour. So that was pretty great at the time. so got plugged into healthcare, and that kind of set me on a path to really focus on health and healthcare, connecting with people, working with them in kind of sometimes dire circumstances, and being able to help them out, I think lit a light for me and kind of gave me some direction as to what I knew I wanted to do. And it took me a while to kind of slowly chart that course. From the University of Minnesota, I went abroad and worked abroad for a little over a year, doing some work in rural villages in Nepal, outside of Kathmandu, as well as with street kids in Delhi, India, and some transient worker slums in Goa, all in India. From there, I had actually been intended to go to medical school, had everything all ready, and was intending to go that direction. But that time abroad and a chance encounter with the dean of the School of Public Health from Tufts in a lounge in Milan, Italy, changed my direction and kind of pivoted me towards public health, as I saw the real value of public health programs to impact people's life and well-being, how well they live those the years that they have on Earth. I think is really important, not just about living, but how well people live. So that really ignited something for me in public health. And so I eventually went to Tufts Medical School in Boston for my master's in public health and global health. And that's where I linked up with the Center for Disease Control at the Boston Quarantine Station. And that's where I continue to work today, not in Boston, but actually down in Miami. I'm nearing my 13th year with the Center for Disease Control, and I'm now worked my way up, and I'm now the regional officer in charge for the Quarantine Border Health and Services branch. Our goal is to prevent and mitigate the importation of infectious diseases from coming into the country. So we've had a bit to do the last several months, and before I've been involved in all major pandemics basically since 2008, H1N1, MERS, Ebola. I deployed out to West Africa and was there for some time. And now with COVID, I've been deeply involved with our border health response in the US. All the entry screening that you have seen stand up around the country is something that I focused on. I stood up the entry screening in a number of airports, JFK, Chicago, LAX, Miami, Dallas, Houston, and also oversaw the repatriation of our US citizens from impacted areas within China and Wuhan, as well in Anchorage and Travis Air Force Base in San Francisco. So again, I'm happy to be here, and hopefully I can shed some light on some insight from CDC.
Thank you, Mr. Clavos. I'm really happy that we have a great panelist today. We have an economist, we have somebody who's in charge of CDC, and we also have a fantastic nutritionist researcher. So I'm going to invite Nithya Ramalingam to moderate the entire program. Thank you, Nithya.
Thank you, Rafi. So as you heard, thank you for those introductions, panelists. As you know, all of the panelists in common, although they come from very diverse fields, they are all affiliated with FIU in some manner, so go Panthers. Before we get started, I just wanted to say, and this is like a fairly intimate discussion, so if possible, participants, if you could turn on your videos, that would be really helpful. I think it would benefit us all and really get the communication flowing between us. If not, of course, I completely understand, but thank you. Okay, so we have a few prepared questions that we're going to ask, and then afterwards we're going to get into individual students' responses. So graduate students, if you have any questions that you want to ask the panelists, please private message me, and I will include those in the discussion. As for the questions that we have prepared, if the panelists could take about 2 minutes to respond maximum, just in the interest of time, we would really appreciate that. So, and you all can take turns answering the question however you see fit. So no worries about any specific order. So the first question I have for you all is, do you have a specific way to engage in networking opportunities that has worked for you throughout your career? Maybe Dr. Aleman, would you like to start with that one?
I can start. I think that life is a networking opportunity. I mean, my ethos is doing your work, doing your job always well and performing well. And that creates a ripple effect that that you are always in the market. I mean, I always say that I am always in the market, even though I have been at Wells Fargo for 16 years. I have been looking for a job for 16 years, correct? Because I am always trying to reach to people and trying to keep my network going. And you know, today it's much easier to have a network, correct? You are in LinkedIn, you are in Facebook, you are in all these social technological advantages or ways of communicating. And I think that doing a good job and keeping abreast of your own education and your own profession is the best way. I am a board member in NAVE, which is National Association of Business Economics. So I keep abreast of all the changes and keep in contact with all the professional economies that are working in the private sector normally. I am also member of the American Economic Association, but because I am not, I did not pursue the teaching path in my career. I went to the private industry. Yeah, then I don't do that much in the school path, but I have been teaching for all my life, professional life. So as an adjunct professor, every time I have an opportunity, I go and teach. Lately, I haven't been teaching because family issues. My mom has Alzheimer's, so we're taking care of her. So it's very, very time consuming. So for now, teaching is not part of my hobby, let's say.
I'm sorry to hear about that, but thank you for your response. I can definitely see how life is just a networking opportunity in general. Mr. Clevis, do you have anything to add to that? Any networking strategies that have worked for you throughout your career?
I do. So I think I got two very short stories that got to go to this, but I'm going to kind of three things that pop to mind. Show up, be persistent, and put your best foot forward. As I was starting undergrad at the University of Minnesota, I was trying to transition because working, go to school, that's been something I've done since I was before I was a teenager. And so that I just knew that I was going to be working, and I wanted to try to transition and get a job up in Minneapolis when I moved there and started school. And my sister, who was about 12 years older than me, very accomplished business professional, I called her up on the way up, and I really wanted to work in the Hennepin County emergency room as an ERT, which is an emergency room technician. And I looked for job postings, couldn't find anything. Seemed impossible to actually get through to anyone. And so the hope of getting a job seemed kind of lost. And so I was very distinctly remember this. I was driving and I could see the hospital a couple miles out, and I talked to my sister, and she says, "Andy, just show up. Give them a call and show up." Wow, earth-shattering. I showed up, and I asked to speak to the nurse manager, and they offered me a job right there. And it just took showing up and being persistent, putting your best face forward. So I'm going to fast forward that, because that was, maybe I lucked out, but it's persistence that's key. One, I was, I've been a student with FIU for a couple of years now, going through my PhD, and concurrently working at the CDC. I've been, prior to my current position as regional officer in charge, I was officer in charge of the Miami quarantine station, which oversees some states. And one student just happened to reach out to me, FIU student, current PhD student at FIU. And she reached out and said, "Hey, I saw that you're a student. I just wanted to see if I could pick your brain, and could I buy you a cup of coffee?" And so I happened to have time before one of my classes. We sat down, we chatted. I let her know about CDC. At the time, I didn't have any positions available to offer to her, but I did have internships, availability. And so that's something, why don't you email me in the future and we could set up an internship. We're gonna have a next round of applications go in a couple months. And so that worked. So fast forward some months, I, completely forget, but she sees me in the hallway. Hey, Andy, it's great to see you again. Hey, I wanted to follow up. And then she saw me again in persistence. And so when I did have a position come open, a few months after that, the first person that came to mind was her. And now she's a full-time CDC employee working here, and she's been a phenomenal asset to our station here at Miami in helping to find COVID. And she's deployed multiple times and still is not losing a beat with her PhD program. So show up, be persistent, put your best foot forward. Never be afraid to reach out to other people, even if it's maybe a circuitous route to kind of get to where you want to go. Start making those networks and start making those connections, because the more you're in someone's mind, the more higher chances are that you're going to be the first one they think of when opportunity does come up.
Thank you for that. Dr. Jabshir, do you have anything to add?
Sure. By the way, Dr. Elliman and Andy, I was taking notes as you were giving tips to the students. Thank you so much. So just adding something else to what was mentioned. Usually before I go to any conferences or meetings, I look up the attendee's name and speaker's name, and I look up their information, which universities they're coming from, what is their research and what they're focused on, what may be their interest. So if I find somebody that I want to get connected to, I know a little bit about them, and then I approach them and say, by the way, I read your paper on this topic, that was really interesting, I have a question about it. And that's how I try to start a conversation. And then later I send them a thank you email and say thank you for helping me. And yeah, that can be a good start.
Thank you. I think that's great advice, getting it in the conversation and, being persistent. I think as young professionals, we can often get discouraged if we don't get responses right away. So that's really helpful advice. Okay, so the next question I have is related to work-life balance. So how did you handle work-life balance in graduate school? And is it any different from how you handle this now as professionals?
Very difficult. I mean, there's no comparison between the work life and school life, especially doing a PhD. And I think that I sorry to start the session myself, but I was married with 2 children. 1 year and 2 months and 2 years and a half. And that is the worst mistake that you can make when you, actually we survive. I have been married for 35 years. Our kids are all graduated from school. They each one has their own issue, but it's part of life. But it's very, very difficult. And I had some really good support. I mean, I chose FIU because my wife is Cuban. My in-laws were in Miami. We're living in Miami, so they provided support. My family helped, her family helped, but even with that help, it is very, very tough. And the question is, what do you need to survive? Is patience, patience, and patience, and dedication and understanding. And if that is what you want to do, I am not going to tell you don't do it, but don't have kids afterwards, because it's very, very difficult.
That sounds like good advice. Mr. Clevis, do you have anything to add?
Yeah, I didn't wait. For my MBA, I started that as I was coming down to Miami, and so I was still a bachelor at that time. But soon thereafter, I found my wife, and now we have 2 kids, age 5 and 7. So the entirety of my PhD program has been in the throes of children, young children at that. And now I get to do remote school learning at home too. So yeah, complexity layers and layers and layers. So I'd say, boy, one, find something you love. Find something you love to do. And I mean, the fact that you're all grad students at FIU seems to me that you found that thing that you love. And so you check that box, right? That helps because one, it helps cultivate a drive to get done. And in grad school, you know, we start with just the love of the subject matter and everything else, but we also have to get it done because, you know, school isn't forever. Careers come after, and so does the rest of life, and usually it doesn't wait. And I would say, don't wait. I'd say, you know, as far as the, you know, the family and the kids, that happens when it happens, and when we're all fortunate enough for it to happen. And so yeah, that's wonderful. But as far as, you know, work and school, don't wait. Start your career search now. And I would say start working now. You will always be busy in life. And the fact that you're grad students means you're probably enjoying being busy and you like that drive. There's probably a lot of type A's in here and who really want to go succeed and achieve a lot of professional success. So I would say try to go for it all and really, you know, don't hold yourself back. Opportunities are always coming around the corner, and I'd say never say no to any of them. You know, as far as, you know, work goes, being able to have your work complement your school and school complement work, especially if you find a job that you can do that's synergistic with your studies, will only, you know, allow you to be more engaged in your school because you're going to be focused. You're going to know how to prioritize better. You're going to be able to organize your life and your schoolwork better, and you're going to be able to knock off those to-dos that are implicit in any grad school program.
Thank you, Dr. Jabshir.
Yes. So I would say know your priorities and make a list of them. Make a list of the things that you need to do and start from the top 3. When they're done, cross them out and then focus on the rest. We all have enough to do to be at work for 24 hours all day, and it's not going to get finished. But when it's time to take a break, take a break. Otherwise, you're going to pay for it later on your way. And also make sure that you have at least one hobby out of school. When I was in school, I really loved classical music. So Adrian Art Center had this program for students. They had discounted tickets for classical performances for students or for ballet shows. So I used to get those tickets and you know, have some off time, spending some time on something that I really like out of school. So that also helped me to shut my brain off from the school and do something else and then come back to it.
Let me say something, and Andy, I agree with you. I would do it again, but my children had the last word. Our third child was born on the day of my graduation, so I could not go to my graduation. She's 25 right now.
Wow. Well, you all with children who are doing graduate school, you are real life superheroes. I can't imagine doing that. But yeah, Dr. Jabshir, I completely agree. Mental health and wellness is a very important thing. Hobbies is a great way to make sure you keep that in check. Okay, so a third question I have for you all is, if you had to do it all over again, what would you do differently and why? Dr. Alaman, would you like to start again?
I'm always first. I don't know. I have to break the ice here. As I said before, I think that I would do it all over again. As Andy said, you do not determine what comes to you. Life determines it. And I worked. I did my undergrad. I worked for 5 years. While I was working, managing a business, I did my MBA. And then I am persecuted by hurricanes. So I went through Hugo in Puerto Rico. Our business was down for 2 months. So I say they will never get me again in an island with a hurricane. Then I went to do my PhD at Miami, and Andrew hit us during my PhD. So Andrew hit us, and then I got a job in Philadelphia, and Floyd hit us back there. So then I moved to Andy's state, to Minneapolis. I did my 5 years in Minneapolis. Thank you very much. And I have been trying to go south since. But beautiful Minneapolis. And my son went to the University of Minnesota. So I would do it again. As I said before, I might have waited to have children, but I started my PhD at 30 years old. So I wasn't that young when I started. So I had to have kids relatively soon. So when I had kids originally, our first 2 kids, 33 and 31, I was not planning to do my PhD. So that is out of the picture. They were not part of my decision. The PhD wasn't part of my decisions, correct? So life takes you where it needs to take you, and you have to follow.
Thank you. Dr. Jabshir, do you have anything to add to that?
Sure. So if I wanted to do it again, I would try to be more concentrated. During my graduate school, I used to try, many different things. I used to go to all the meetings, all the socials. So I think I was doing too much of networking during my graduate school. So I would try to be more concentrated on what I wanted to do, and take one step at a time. And I would try to have a better work-life balance.
Thank you so much. Mr. Clevis, do you have anything to add to that?
Well, first for Dr. Alman, rah Sky Ma for your son. So university, go Gophers. Yeah, would I do anything differently? No, I wouldn't. No regrets. I've loved every second of it. You got to squeeze it for all it's worth, and just continue forward and learn from your mistakes. But otherwise, no regrets. I wouldn't change a thing.
That's great to hear. Okay, so the next question I have from a student: sometimes I have my doubts about if I'm taking the right path. How did you know that you were going the right way?
I think that it was my way, or the highway. For me, it wasn't that big of a deal. I mean, I had done my undergrad, then I work in the private industry. I manage a business, and then I say I need more. I mean, I am an immigrant to this country, and I always thought that I had to do more than an American, correct? So this is kind of what immigrants go through during their life. They think that they have to go a step higher than locals, and that was my driver, the driving force. I needed to perform or to do more, not because anybody asked me to do it. It's because I felt the need to do it, and it all worked for my advantage because it put me ahead of many other people that were not doing the same thing. So it works always. So
don't get me wrong. There's times where you're going to question what you're doing. I think that happens for everyone. Am I doing it the right way? Am I doing the right path? Is this really for me? And usually those times come when it's hardest. But I would say, make sure you focus on what you love. And if you're doing what you love, you're doing the right thing. When times get tough, fall back on those that you do love, your family, your friends, and your support network, because they are there to support you. And even though we're, the ideology of American being rugged individualism and stuff like that, nah, we all need friends, we all need family, we all need a support network that's going to be there to help make sure that we get up the next day and we go right back to the fight and keep on just moving forward. So I'd say, we're all going to have moments where it seems dark, where it's hard to keep on checking off items off that to-do list. But I'd say, with that support network, and as long as you are doing something you love, then you're good to go.
Dr. Jabshir?
Sure. So I think Dr. Alleman and Andy just made great points. Adding something to it, give yourself some time. Be nice to yourself. You're not. Success is not an event; it's a process. So sometimes opportunities show up that may not look like what you were looking for. Take the opportunity. Give yourself some time. It may expand to what you were looking for. I can give you an example of myself. The job that I had was initially teaching, and I was passionate about teaching and research. But I took it, and after some time, I could get a grant and start doing research too. So it took, at least 1 year to get there, but it happened. So take the opportunities, do your best, and more opportunities are going to show up.
Thank you so much for that. So the next question that we have from the students is, what was your decision process that drove you to get your PhD? How did you research schools that best fit your future goals and endeavors?
I'm an economist, so money, money, money. For me, it was a no-brainer. I had 2 kids, wife. My parents own an apartment in Miami. My in-laws were living in Miami. FIU offered me a financial help, and the rest is history. I started teaching immediately as I started my PhD, and probably those students want to kill me now, but that's what you do.
So I took my time to try to figure out what I wanted to do with my PhD program. And I wasn't set on a PhD. I was researching a lot of options available. I knew that a doctorate degree was in my future. It's something that I wanted to do personally and professionally. So I took my time to try to figure out what exactly that would be. And I actually wavered between a PhD and a Doctor of Public Health, a DRPH or DPH. There's great programs out there that are online. University of North Carolina has an excellent program. So I took some time. A couple of key factors that pushed my decision. One, I wanted an in-residence program. Miami was home. And my wife's phobia of cold meant I was not moving back to Minnesota any other time in the near future. So Miami was going to be home, and I really wanted an in-residence program. And so that narrowed the field to a degree, and that's going to be an important decision for a lot of people. The second part was, which PhD program was going to be right for me. One, it had to align with my interests. It had to be something that was going to be something that I enjoyed doing, that fascinated me, that captivated my imagination, and I could see me actually working and applying that in the future. And so when I started looking at programs, I reached out and I cold called some program directors. And one of the people I cold called was Dr. Timothy Page out of the Health Policy Management Department. And after a few minute conversation, he invited me in to come talk with the chair and him. And after that conversation, I just knew that this was the place for me. It was I was able to connect with them. We had not just conversations about what our interests were as far as academic or other and work, but it was as well as a personal connection. I knew that once I started this program, I was going to have an awesome support network behind me, because not only did I enjoy talking to the people that I was quote unquote interviewing with at that impromptu meeting, but I knew that they would really have my back, help propel me forward, challenge me to be a better version of myself. And when it came to academics, that's something that I really wanted. So I think it was a combination of decisions, but you know, in the money was also a key factor. But you know, we make it work. So yeah.
Nitya, you're muted.
No, I was just going to ask if you had anything to add, Dr. Jabshir.
Sure. So the reason why I pursued a PhD, I enrolled in the PhD program, was because I always wanted to become a faculty since I was in the elementary school, and I was always passionate about healthcare and biomedical sciences. So the only way that I could become a faculty was to get a PhD. But why I did PhD in nutrition is that at that time, when I was applying for graduate programs in the US, I came here as an international student. So the nutrition program, the master's in nutrition, was one of the few that didn't need a GRE. So that's why I applied to this program and I got accepted and I came. And after some time, I became really interested. I mean, I was interested, that's why I applied, but I felt like I want to continue doing this. I was already involved in research. I was a TA. I was involved in teaching during my master's. So then I had to take the GRE. And then I became a PhD student and continued my path.
Thank you for sharing that. Okay, so the next question I have is, what was the biggest cultural adjustment? I guess this is directed at Dr. Aleman and Dr. Jabshir as well, if you have anything to add to it, because you both are immigrants. So what was the biggest cultural adjustment you had to deal with entering the US job force, and how did you handle it?
You know, that's a good question, but I am originally from Argentina. But my parents moved to Puerto Rico in the late 60s. So I was raised in Puerto Rico almost most of my life, my young life. Then I moved to Miami, and I mean the transition wasn't perfect, but because my English wasn't good. I mean, it's not good today. So imagine 25 years ago, it wasn't that good either. No, I mean, I didn't have that big of an issue adapting to the workforce in the US. My first job was in Puerto Rico. Out of graduation from FIU, was in Puerto Rico, the professor and director of a graduate program at a university. And then I got a job immediately after in Buenos Aires, in Argentina, at Shell. Due to my network, friends of friends of friends that recommended me, got a job in Buenos Aires. I stayed there for 2 years and a half. Things were in Argentina were again getting worse. And then I came back. My father-in-law passed away in Miami. So we realized that we were very, very far away from family. We came back. Actually, I was interviewing from Buenos Aires. I am an early internet user. My job out of from Buenos Aires to the US back, my interviews were over the internet. And this was 1998, 1999, 1998. So this is a long time ago. I started interviewing with this company out of the suburbs of Philadelphia when I was still living in Buenos Aires. And then I moved back to the US and they hired me. Then I networked again, NAVE, the National Association of Business Economics. they had this advertisement of a company, and I did not know the company that was looking for an economist. I applied, and in 2005, I was at a conference in Germany, in Frankfurt, and I received a call on my cell phone, a lady saying if I was still interested in this position that I had applied in December of 1994, in 2004, and I said, sure. Well, the position is in Minneapolis, and I couldn't care less. I did not know what Minneapolis was at that time. So I say yes, and the rest is history. I did not have that many issues in the transition because I was raised in Puerto Rico, and you know, I mean, the exchange between the U.S. and in Puerto Rico is very fluid, even though many Americans don't know what Puerto Rico is anyway. So
Yes, that is unfortunate. But does anyone else have anything to add to that?
I just wanted to say that I feel that I was very lucky that I started my first job here in Miami, because we have a diverse community here and we have a big immigrants community. So before I come to the US, I was a little bit scared that I go there and I have an accent. People will start laughing at me in the classroom. But then when I came here, I felt very welcome, and I noticed that other people have accents too. And I think this is a great place for, you know, for an immigrant to start.
That's very true. We have a very diverse population down here in South Florida with a wide range of accents. So there's no need to worry about that at all. The next question I have is specifically for Mr. Clevis. So what first steps would you advise someone who's interested in health policy to take?
Oh, I would say health policy is broad. It goes everywhere, and I think that's the flexibility is actually the great part of it. You know, if you have a specific interest in a particular area of public health or health delivery, I mean, health policy touches it all. I mean, my goodness, I think I was just listening to something because the Affordable Care Act was in the news again today because it's up at the Supreme Court, right? And they referenced it was 900 pages. 900 pages, because it has to touch and talk about the breadth of the U.S. healthcare delivery system, which is enormous. It touches on public health. It touches on prescription drugs, operations of hospitals, and trying to get good preventative care measures in. So I'd say, you know, if you're looking for health policy, one, find the area that really catches your interest, and you know, look for opportunities. Actually, I mean, if you don't have a particular interest, I mean, some people really come at it like I really, you know, something's maybe touched your life and your family, and that's something that is really driving you and propelling you forward. Maybe drug abuse, you know, if that's an area that is, you know, it's your calling, you know, there is a wide array of policy options and jobs and academic research opportunities that are really deeply sewed in to all of those areas that really may speak to something that is a personal driver for you. But if, you know, your interests are a bit more broad than that, I would say look at where the jobs are. Health policy is something that's flexible and applicable to a lot of different organizations, institutions, agencies, and they have lots of different areas that you could jump in and focus. So, for example, CDC is enormous. You could work for this organization and never know a single thing about infectious disease, but you could be a subject matter expert in injury prevention, and you might want to focus on policies that really revolve around that. Or prior to COVID, it was the opioid crisis. There was hundreds and hundreds of jobs just within CDC alone. And a health policy focus would have been a large part of that, helping to not just cultivate policy, analyze policy, but also to put policy into action, interpreting policy to make it operable and implementable to actually serve the public, improve health. So I'd say start looking for jobs now. Don't narrow down to a specific interest unless you really are driven. And even if you are driven by a particular focus, don't make that the first step that you need to take to get a job or to go into an organization. Go get your foot in the door. Go get your foot in the door and then lateral and move around once you're in. Especially with government jobs, it matters a lot to actually just get your foot in the door, and then the mobility opens up. So if I know a lot of people in public health, my area of focus, I know it's not everyone here in this, but even if you're looking at this probably is applicable to private industry too. I'll let others weigh in. But getting your foot in the door, expanding your network within an organization to start applying the tools that you have cultivated or are cultivating, because you still could be in school while you're searching for jobs, I think is a great avenue. So I'd say don't turn down opportunities, be broad in your search initially. And then if you really want to help that, start to narrow your focus to really drive you in the direction you know you want to go.
Thank you. That was a very comprehensive answer. So I'm sure it'll help many people. Okay, so the next question we have is related to COVID-19. So as we know, and as we've kind of discussed earlier before the graduate students came in, COVID-19 has turned over everything that's been established the way we know it. It's messed up the status quo and all of that. So how has COVID-19 affected each of your sectors, and what future changes do you anticipate as a result of the pandemic? Dr. Aleman, would you like to start again?
So I used to work hard, and now I'm working harder. Much harder. So we used to, right now what I do is forecast for stress testing, for financial stress testing, regulatory environment. It's a mess. And we normally do every quarter we do forecasts. Now we are doing forecasts over almost every month. And we do not do one scenario. We do 3, 4, 5 scenarios every time that we do forecasts. And for something that was manageable before, it has become really unmanageable. So there's a saying that if you don't forecast right, forecast often. Well, we are forecasting very often because we are always wrong, correct? Because every day you have more information, and information drives concerns, and concerns drive your boss crazy, and your boss drives you crazy. That in that order. So work, work, work.
Yeah, definitely everyone is being overworked despite working from home. So Dr. Jabshir, do you have anything to add to that?
Yes, sure. So I know there has been a lot of disadvantages regarding the current situation, but if there is an advantage about the current situation about a pandemic, is that it may have pushed us forward in using technology in education and healthcare at least 10 years. So before, taking classes online was not that common, and getting a degree online was not maybe that much appreciated compared to degrees that you're getting in person. But now there was a time that we had to do everything online. There was no other choice. So I think there is more respect for doing the job online, and to take classes online, and also in healthcare, we just did a study in telemedicine, and we're still processing the data, but also the use of telemedicine among even underserved populations, it was not very common, but now we're using it in, in different areas, which is, I think, an advantage of the current situation.
Thank you. Mr. Clevis, do you have anything to add? You're definitely in the center of this pandemic. You're working at the
Yeah,
CDC.
I've logged a lot of hours over it's November, right? So 11 months plus. It's been crazy. I'd say going into, as I was in the throes of COVID, still are, it demonstrated something to me that it still echoes in my head. The worst case scenario can and will happen, kind of like Murphy's Law. But this year in particular, the bad outcome can happen. But don't let that kind of determine what you need to do and how you need to do it. I completely agree that there is opportunities hidden in this, and I think you just noted some very wonderfully. I think, even though our engagement in Zoom calls like we're doing right now, we wouldn't have done this previously, but I think this has also opened up opportunities, not just professionally to engage with one another, maybe even more frequently, seeing each other face to face, but also in our personal lives, being able to connect with relatives we haven't talked to as frequently. So COVID has changed a lot, and I think in some areas it's given job insecurity, and other areas it's given job security. I think the world is still figuring out how this is going to play out ultimately. But I think looking for those hidden opportunities, the hidden positives that come out of something like this is kind of critical for us all to make sure we remember and focus on.
Yeah, that's really great. There's this quote, never let a crisis go to waste. So I feel like that's very applicable in all of every industry right now. Okay, so we have one last question from Sweta Gupta. She requested that she ask the question herself. So Sweta, would you mind?
Thank you, Nitya. Hi, everyone. My question encompasses everybody, nutrition, public health, and economics, all combined, and I throw it to India. In India, we have a lot of population, and there is people dying of hunger every day when we are talking every moment, and there is not enough sanitation, and government increases taxes to leverage out of people, and in the name of increasing the facilities, while it never goes to the uh, real people where they need it. So I have worked with government for 7 years, and I myself find it very hard to get into the roots where things can be changed. So I really would love to hear your opinion on that. And as Andy mentioned, like, he has been to Goa and all these countries, so he has seen for himself how things are there. So I would love to know the opinions, and if there is anything that could bring a change.
That's a great question. And it's one that is often fraught with frustration, wanting change and yearning for it, trying to push for change, and yet in our view, not seeing it, or at least not seeing the tangible aspects of it. Since we're talking about India, a famous quote from Mahatma Gandhi is, "Live the change you wish to see in the world." That's something that I think has kind of hung with me since my time in India, when even though, no matter what I would do in that time, or no matter what a lot of people would do, there's so many problems abounding around you. Poverty, lack of sanitation, pollution, corruption, a perverse policy that pulls taxes from the people who need them to the people who don't. these things can be terribly frustrating. And I think it could be very easy to get bogged down in the kind of almost a despair in trying to deal with this overwhelming number of problems. I have let that drive me. I have tried to translate that sometimes anger, frustration, when you see these problems abound everywhere. And I mean, for goodness sakes, just go turn on the news and you're gonna get an earful. I use that to propel me forward as much as possible. And I try to not get frustrated by what I am and am not able to accomplish, but take solace in what I am able to do and how I am able to live. So in my own life, I have worked to embody that quote by Mahatma Gandhi and live the change that I do want to see in the world. It's more than just what I can do, but it's how I live, it's how I demonstrate my life. And I would say that if you are able to make a dent in some of the problems you see, you have made a change and you should be very happy for it.
Do any of the other panelists have anything to add to that?
I have a prescription, but from the point of view of an economist. And my prescription is you need us, and it's something that we are lacking in the US. We need a new social contract. Any society or every society, every state, nation state needs rules, needs a social contract, needs to know who are going to pay into the system, who is going to benefit within the system. Very often, as Andy says, you tax those who shouldn't be taxed and give the money to those who you shouldn't give the money to. But that's why you need a new social contract. You need to bring everybody into the economy, make everybody a formal worker. I mean, informality in an economy is the worst thing that you can have because you do not belong to anything. And then you are always outside of the system. The US has one of the best ways of bringing people into the system. Why? If you don't have credit cards, if you don't have credit, you do not belong, correct? If you do not file your taxes, if your parents do not file their taxes, you cannot get help from the government. You have to do the things that you need to do in order to incorporate as many people as you can in the society. And you have to involve everybody. And then you have to bring everybody into the system and tax those that can pay. You know, you cannot tax those that cannot pay. And then you have to redistribute income. I know that income redistribution is something that people say, oh, this Aleman guy is a communist. But it's not. Income distribution doesn't mean that I am going to throw money to people. Income distribution means better health, better education, investment in healthcare, investment in education, investment in social networks. I mean, investment in everything that people need in order to be able to get out of poverty. And until that new social contract is not agreed upon, it is very, very difficult because everybody that goes up wants to steal because the next one is going to steal more. And let's steal before the other one that comes behind me can steal more. So it's a never-ending situation. So I don't know. That's about what I have to say.
Thank you for your responses. I think that's especially profound coming from an economist. So it is 7 o'clock now. So unfortunately, our time today is up. I want to thank again the panelists for coming and taking time out of their extremely busy schedules to speak with us and give us advice. As young professionals, it means so much to be able to speak to people like you who have so much experience. So thank you again, just a virtual applause, little emoji things. Thank you all. And then for graduate students, thank you all so much for coming. We really appreciate it. If you ever have any concerns in the future regarding graduate or professional school, feel free to reach out to us, GPSC. Our email is gpscchair@fiu.edu. Thank you all so much for coming again, and have a great night.
And start saving as soon as you can.
Pleasure seeing everyone. Take
Bye,
care.
thank
It's
you.
good to see you guys. Bye. Thank you for coming.
Bye.
Bye-bye.
Bye.
Thank you, everybody.
Bye.
Bye.
Nate,
Christian.
great job. Great job,
Thank
Nate.
you.
Yeah,
Thank
very
you.
good.
That went really well, I thought.
Yeah,
Yeah.
tremendous.
Students were really engaged.
Yeah.
Okay.
So is there anybody outside GPSC right now in the chat?
Yeah.
Yeah.
Okay.
I just removed
Okay.
them.
Yeah.
Thank you. So
Make sure
it
to stop
was-
the recording.
Oh yeah.